400 meters. That was her specialty. She had a school record. Did you know about that?
Which?
That she had school records in all these disciplines?
No, I didn't.
Julia was very accomplished, very bright. Life as part of the team, that was very important for her.
She had a good sense of humor, and we had really a lot of laughter. To her, the next person was as important as herself, always.
She also has a special interest in dealing with kids. She spent the summer internship in DC, some kind of organization that fights for the rights of children. We got a phone call that rings in my mind every day.
It was 1999, and I was living in Washington, D.C. My husband Henry and I were coming home, and we drove onto our street, and we saw a couple of people standing around someone who seemed to be on the ground, collapsed, and not moving in the crosswalk. Very, very close by was a fire station, and we thought for sure that there would be a response by DC Fire and EMS, and we didn't hear any sirens. So someone took it upon themselves to run across the street. He tried to implore the folks at the firehouse to help, and he was told that they were changing shifts and they couldn't come.
We understood this to be related to cardiomyopathy. Apparently, that sudden cardiac event happens among the athletes. This unfortunately requires a very quick response time.
Finally, it seemed they paid attention and eventually came over and rendered aid. There was also more confusion with the dispatch and the 911 calls. We watched just in agony as we saw an ambulance coming towards us. When it got to the intersection, it turned the wrong direction. Finally, they placed her on the cot and then left the scene.
Never felt so helpless. I just had nothing in my power to be able to make a difference in this woman's life. She needed CPR and she needed an AED, and she didn't get that in time.
That was a shocking realization, and how quickly our life could be shattered.
She died needlessly due to bystanders who didn't know what to do to help, and a fire and EMS system that, for some reason, was dysfunctional.
I knew nothing about how to help someone in that situation. I was a high school English and journalism teacher, did it for more than a decade, and then switched careers and became a paramedic. I work still as an educator, trying to bring the most up-to-date content to EMS providers who are learning how to do the best things that they can do for their patients.
Raise your hand if you know your survival to discharge rate percentage for your cardiac arrest patients.
Sudden cardiac arrest means that your heart has stopped beating normally, and it is no longer perfusing and sending oxygenated blood to the organs. For every minute that a person's heart is stopped, their chance of survival decreases by 10%. It truly does mean that in the first 6 minutes of your collapse, your life depends on getting cared for right away.
I learned as a paramedic in Denver that life and death is defined by geography. Medicine doesn't like to talk about these disparities that are a result of medical systems. As a reporter, I was trying to show this nationwide. I wanted to show which cities were safer and which were not as safe. I learned about Julia Rusinek when I was doing an investigative series for USA Today on EMS performance across the country. And I was looking at the major cities and how they performed in cardiac arrest survival. And the Julia Rusinek case was a shining example of how tragic the care was in Washington at that time. We're losing between 1 and 3 airplanes a week of people like Julia Rusinek who could easily be saved. They're dying needlessly in this country. These victims of sudden cardiac arrest are kind of written off by a system that says, oh, well, we did the best we could. So what's missing is that analysis. There were 3 basic findings for my series. One was the importance of everything that happens within that first 6 minutes. The second element was once a city decides to try and save more lives and be very intentional about it, it requires them to have really active medical oversight. And the third part was the political will that is required to make these change is significant. It really got the conversation going in a lot of cities across the country. My hope was that every city would see that series and say, where are we on this map? What is our performance? And what gaps do we need to fill to save more lives?
Back in August of 1997, when I came to Hilton Head Island, I was hired on as a firefighter paramedic, and I did that for 24 years. I do remember reading 6 Minutes to Live or Die and being alarmed by it. I understood right away that Hilton Head Island was one of those communities that didn't know its numbers. We had no idea how many cardiac arrests a year that we responded to, how often there was bystander CPR. We were basically flying in the dark. We put a presentation together where we estimated the number of cardiac arrest cases we attended. We guesstimated pretty accurately how many of those were going to be witnessed versus unwitnessed and how many of those were going to be shockable. Let's say we saved 10%. Well, we said if we could just improve that survival rate to 40%, then we would have 6 survivors a year, which meant that in 25 years, we could save 150 people.
65-year-old male in cardiac arrest, engine 3, medic 5, arrive on scene.
So we made it our explicit goal to improve cardiac arrest survival, and we had got buy-in from the entire command staff. One of our deputy chiefs had the idea that we should mock up a jet airplane with 150 seats and hang it up on the wall of fire rescue headquarters. Whenever someone that had a bystander witness shockable cardiac arrest survived a hospital discharge with good functional capacity, they would get a seat assignment. So we would put a heart on that seat and the date of their resuscitation, and we would go about holding ourselves accountable for saving this 150 lives in 25 years. These changes that we made were sustainable.
Hilton Head 911, do you have a police, fire, or medical emergency?
We were just working out, and all of a sudden, the other person we were with noticed she was just laying down. She's not breathing.
Okay, ma'am.
There are many cardiac arrest survivors that are meaningful to me, but one that stands out to mind just because she was so young. She was working as an intern at a place called Hilton Head Health, and she collapsed.
She's just laying on her back. She's not moving anymore.
Listen to me very carefully, okay? I'm going to tell you how to do chest compressions.
Her fellow interns worked together as a team. One dialed 911, one started CPR, the third one ran out into the parking lot to guide the incoming paramedics. And our telecommunicators did a really fantastic job. They made sure that the CPR was at the correct rate, depth, and recoil. When they arrived on scene, Amber was in ventricular fibrillation, paramedics applied a shock, and we got her back. I keep track of her on social media because we're friends. I saw Amber's boyfriend on his knee proposing to her. And then the very next picture, a big puff of pink, and I thought, oh my gosh, our cardiac arrest survivor Amber is gonna have a baby. When When I reflect on Julia Rusinek and all that was lost that day, to compare that to Amber, both of them 21 years old. In one case, system didn't work. In the other case, the system did work. One leaves a trail of devastation. The other, a beautiful young woman, gets married and has her own baby and has so much hope and love. What does that mean?
These are not just cases, these are people that need help. These are individuals. I see human lives at stake and human lives that could be either saved or not.
Cardiac arrest is not a death sentence, at least not in the United States. It shouldn't be. What gets in the way is system dysfunction. Like anything else, systems can be improved.
So it starts with public awareness and recognizing what sudden cardiac arrest looks like. It starts with bystanders being trained how to do CPR and highlighting certain systems like Washington, D.C., who have made enormous strides in improving their survival rates. The most important thing that an EMS system can do is measure what their performance is. Without measuring, we cannot improve.
If you make it your explicit goal to improve cardiac arrest survival, then you start asking the right questions, you start measuring the right things, and you start thinking about how your system is actually performing compared to how you think it might perform.
The public has a right to know this information. EMS and cities have a responsibility to act on it. And as citizens, we have a duty to pay attention. The change that's required to save these lives starts right here. It's personal will, it's caring. And once you get it and you care about it, then you can measure what's going on around you and you can take action.
What I'm hoping is that we're going to put this on the front burner and people are going to pay attention, and many thousands of cardiac arrest patients, like Julia, like Amber, will have a chance of life.